Welcome to the Deep Dives. We take your sources, we dig through them, and we pull out the really important stuff. Today, we're plunging into something that, well, it might seem a bit niche, but it's actually crucial for equine health. Equine hypophosphatemia. Now, you've probably heard about calcium issues in horses, right? But phosphorus, it's often the kind of the silent partner in the mineral world. So what exactly is hypophosphatemia? And why should you really care about, low phosphorus in a horse's blood?
Indeed. And it's a big one. Phosphorus is one of the most abundant elements in the body. Over 80% of it is actually in the bone, complex with calcium, forms that hydroxyapatite structure.
Hydroxyapatite.
Yeah. And beyond bone, it's also the main intracellular anion inside the cells, and it's critical for things like nucleic acids, phospholipids, phosphoproteins. But really the most important thing, cellular integrity, metabolism, they fundamentally depend on phosphate compounds. Think ATP.
ATP, the body's energy currency.
Exactly, the energy currency. And various enzyme systems, too. They all need phosphorus to work.
Okay, let's unpack that a bit. Hydroxyapatite, intracellular anion, nucleic acids. So quite a bit of biochemistry. For those of us who aren't biochemists, can you give us maybe a simpler analogy? Like, what's phosphorus doing? Is it like the glue and the fuel for every cell?
That's actually a great way to put it. Yeah, think of it as, well, both the primary building block for the skeleton, the glue for strong bones, like you said, and also the crucial spark plug for energy in every cell.
Oh, okay. Spark plug.
Right. Without enough of it, every single cell struggles to make the ATP it needs to do anything.
Anything, like muscle twitches, thinking?
Everything. Muscle twitches, thought processes, you name it. So it's absolutely fundamental. And when those blood levels drop too low, that's hypophosphatemia. Specifically, we're talking abnormally low inorganic phosphate in the blood, usually below, say, 2.5 milligrams per deciliter in adult horses. Foals are generally higher, of course, because they're growing so fast.
Got it. So if it's that central to energy, to cell function, a deficiency, it must cause some pretty significant ripple effects, right? Way beyond just the bones. Our mission for this deep dive, then, is to explore the causes, which sound like they can be surprising, understand the signs, which might be subtle, and learn how it's diagnosed and, well, treated. What strikes you as the biggest surprise or maybe misconception about how a horse even gets low phosphorus?
Well, it's interesting because it's not always just about what they don't eat. I mean, that's definitely a factor, sure. But one of the maybe most shocking things is how trying to help a starved horse too quickly can actually trigger a life-threatening phosphorus crash.
Wow.
But if we break it down simply, there are basically three main pathways to hypophosphatemia. You've got decreased intake or absorption. You've got increased excretion, or, like I just mentioned, the shift of phosphorus out of the blood and into the cells.
Okay, right. So decreased intake or absorption, increased loss through excretion, or this sudden internal shift, especially with that refeeding thing you mentioned. Let's tackle that first one. Decreased intake or absorption. How does it usually play out?
So prolonged anorexia or just plain starvation is a really common one, especially in horses with chronic diseases or sadly neglect cases. If a horse just isn't eating enough for a long time, its phosphorus reserves, mostly in the bone, they just get depleted.
Makes sense.
We also see it sometimes with phosphorus-deficient soils or forage. Horses grazing certain pastures or eating certain hay, they can develop a chronic deficiency over months. And then there's intestinal malabsorption issues, maybe conditions causing chronic diarrhea. That leads to more phosphorus lost in the feces. Even accidentally eating certain phosphate-binding antacids can reduce how much they absorb.
Okay. And what about the other ways? Increased excretion. That sounds like kidney trouble.
The kidneys are definitely involved. And this is one of the really unique things about horses. Surprisingly, horses with chronic kidney disease, they can actually develop hypophosphatemia, low phosphorus, and often hypercalcemia, high calcium.
Wait, low phosphorus with kidney failure. That sounds backward.
It is backward compared to other species. Like in people or dogs, kidney failure usually makes phosphorus go up.
Right.
But the equine kidney is incredibly efficient at handling phosphorus. And sometimes in chronic disease, it seems to just sort of waste it, even when kidney function is generally poor. Beyond that, there are some very rare conditions, like primary hyperparathyroidism, where you get excess parathyroid hormone, and that directly tells the kidneys to excrete more phosphorus, and some specific rare kidney tubule disorders, too.
That kidney thing is really fascinating. You said it's unique to horses. What makes their kidneys handle phosphorus so differently than, say, ours or dogs? Is it their metabolism?
Yeah.
diet.
It's thought to be mainly down to species-specific differences in how the renal tubules, the kidney's filtering units, reabsorb phosphorus. Horses have this remarkable ability to get rid of excess phosphorus through urine. It's a powerful system. But in chronic kidney disease, that system can get dysregulated. It can lead to this paradoxical loss of phosphorus, especially when calcium levels start creeping up. It's a really key difference.
That is key. Okay, now what about that third category? The sudden shift of phosphorus inside the body, that's the one you hinted, could be really counterintuitive.
Yes, this is absolutely critical, especially when dealing with starved or anorexic horses. Refeeding syndrome.
Refeeding syndrome. Oh,
The
wow.
really shocking and frankly dangerous part here is that trying to help a starved horse by feeding it too much too quickly can trigger this sudden, severe phosphorus crash. It can be life-threatening.
How does that happen? Just by eating again?
When these horses are refed rapidly, especially with high carbohydrate meals, think grains, there's a sudden surge in insulin release. Insulin's job is to drive glucose into cells, but it also drives potassium and, crucially, phosphorus into cells too.
Oh.
The cells need all of that to ramp up metabolism again, making ATP, glycogen, protein, fat. The sudden rush into the cells pulls phosphorus out of the bloodstream, causing a rapid and often severe drop in serum levels.
Wow.
And it's not just refeeding. Giving therapeutic insulin, certain conditions that cause alkalosis, either respiratory or metabolic, even giving IV dextrose fluids without enough phosphorus can cause the same kind of shift.
Okay, those are a lot of ways for phosphorus levels to drop. And some sound quite specific to horses, like that kidney situation. So if a horse has low phosphorus, what does that actually look like? What are the signs? Are they obvious or more subtle?
Well, that's the tricky part. The clinical signs are often quite non-specific. They might not even be noticeable until the deficiency is pretty severe or has been going on for a while.
Which makes diagnosis difficult, I imagine.
Exactly. Because phosphorus is so tied to energy metabolism, the symptoms often reflect, well, poor energy production and reduced oxygen delivery to the tissues. So you might see just generalized muscle weakness, lethargy, maybe stiffness, or the horse just seems reluctant to move. In more severe cases, you can get muscle twitching or even actual muscle breakdown. That's rhabdomyolysis.
Rhabdomyolysis.
That sounds serious.
Like the muscles are literally breaking down.
That's exactly what it is. It's severe muscle damage where the fibers are destroyed. And that's dangerous because it releases cell contents like myoglobin, which can really harm the kidneys. It can definitely be life-threatening.
Okay, so muscle damage. What about neurologically?
Neurologically, horses might just seem dull, maybe disoriented, a bit uncoordinated. And in really severe situations, you could see seizures or a significantly altered mental state.
So muscles, brain. We think of phosphorus in bones, obviously, but where else does this deficiency show up? Are there any less obvious but still critical impacts?
Oh, absolutely. The cardiovascular system can be affected. You might see a rapid heart rate, or the heart muscle itself might not contract as strongly. Even cardiac arrhythmias can happen because of that impaired ATP production. The respiratory muscles can weaken too, potentially leading to breathing difficulties. Horses might just go off their feet anorexia or have a poor appetite. And one of the really severe signs, usually when phosphate levels drop critically low, like below 1.0 milli-GDL, is hemolytic anemia.
Hemolytic anemia, so the red blood cells, the oxygen carriers, they're being destroyed.
Precisely. Their cell membranes become fragile because they can't generate enough ATP to maintain their structure, so they break apart hemolysis. This leads to anemia and a serious problem with oxygen delivery throughout the body.
Wow. What would that look like?
You might see pale gums, maybe jaundice, a yellowish tint, and sometimes even reddish or brown urine because of the hemoglobin being released. And on top of that, white blood cell function can also be impaired, making the horse more susceptible to infections.
Okay, that's a lot of acute, severe signs. What about the long-term effects, especially on the bones, where most of it lives?
Right. For chronic deficiencies, particularly in young growing horses, you can see pretty significant skeletal problems. In foals or young horses, it might look like rickets. That means bone pain, lameness, maybe enlarged growth plates at the joints, bone deformities, even fractures.
Oof.
In adult horses, a chronic lack can lead to osteomalacia, which is basically a softening of the bones. Other nonspecific signs of just chronic deficiency could be poor growth, weight loss, maybe a rough hair coat. And if you look at the history, say in a case of chronic renal failure causing it, you might note weight loss and increased drinking and urination. With dietary deficiency, maybe poor growth, lameness, even reduced fertility. And on the physical exam, poor body condition, maybe mouth ulcers, or even Pica.
Pica, like eating weird things, dirt, wood.
Exactly. Chewing on non-food items, it can be a sign of mineral imbalances.
So a really wide range of signs, many of them nonspecific. That does sound tricky for diagnosis.
Right.
How do vets actually confirm it's hypophosphatemia and figure out what's causing it?
Well, the main diagnosis relies on measuring the inorganic phosphorus level in the blood serum. If it's below the reference range, that's definitive. But, and this is important, the blood sample cannot be hemolyzed. If red blood cells have broken open in the sample, they release phosphorus, and that gives you a falsely high reading.
Oh, good point.
Alongside phosphorus, measuring serum calcium is really important. It's often normal or maybe even a bit high in those chronic kidney failure horses we talked about. But in refeeding syndrome, you often see low calcium hypocalcemia and low magnesium hypomagnesemia right along with the low phosphorus.
So you're looking at multiple minerals. What other tests help pin down the cause?
You'd typically run a full blood work panel. A complete blood count, or CBC, checks for anemia or signs of infection. We look at muscle enzyme levels, things like CK and AST. If they're high, it points to muscle damage, like that rhabdomyolysis.
Yeah.
Blood glucose and insulin levels are relevant if you suspect refeeding syndrome. Kidney values BUN and creatinine assess kidney function, obviously. For really specific causes, like that rare hyperparathyroidism, there are specialized labs that can measure parathyroid hormone and vitamin D levels, and electrolyte panels are crucial for catching those other imbalances, like low potassium or low magnesium.
So lots of blood tests. Anything else?
Oh, yeah. A really thorough history from the owner is vital. What's the horse eating? Any changes? Any other health issues? Plus a full physical exam. Sometimes analyzing the actual feed for its phosphorus content can be useful. And x-rays, radiographs, can show skeletal changes in chronic cases, but you need pretty significant demineralization, like over 30% loss, before it's obvious on an x-ray.
Okay. So once it is diagnosed, how do you treat it? What are the immediate steps and the long-term plan?
Treatment really focuses on two things. Correcting the phosphorus deficit itself, but crucially, addressing whatever the underlying cause is. If it's a straightforward dietary deficiency, then supplementing the diet makes sense. Using appropriate phosphorus sources, like decalcium phosphate or specific mineral supplements. But you always have to make sure you maintain a balanced calcium to phosphorus ratio. Generally, that's about 1.5 to 1 to 2 to 1 calcium to phosphorus for adult horses.
Right, keep the balance.
Now, for refeeding syndrome, the approach has to be very specific and careful. You absolutely must start refeeding slowly, very gradually, and use high fiber, low carbohydrate feeds, good quality grass. Hay is ideal. No grain dumps. And critically, you often need to supplement phosphorus, potassium, and magnesium, sometimes starting even before refeeding begins and continuing during, to prevent those dangerous drops when the cells start taking everything up.
So it's not just adding phosphorus back, it's doing it incredibly carefully and managing the other electrolytes simultaneously. What about horses that are really severely ill?
For severe cases where the horse has clear symptoms, or in that refeeding situation, sometimes intravenous IV phosphorus administration is necessary. But this has to be done slowly, very carefully controlled infusion rates.
Why slowly?
Because giving it too fast can cause its own problems. You could overshoot and cause hyperphosphatemia, too much phosphorus. It can also cause phosphorus to precipitate with calcium in the blood, forming solids, which is dangerous. And it can ironically cause hypocalcemia, low calcium.
Wow, okay, delicate balance.
Extremely delicate. So typically very low doses per hour are recommended, and you need intensive monitoring. Checking serum phosphorus, calcium, potassium frequently, maybe even an ECG to monitor the heart during the IV therapy. And beyond just the phosphorus, general supportive care is vital. 5E fluids if they're dehydrated, nutritional support if they're not eating, correcting any other electrolyte problems, and managing complications like that hemolytic anemia or seizures if they occur. And for those tricky chronic renal failure horses with high calcium, special dietary care like avoiding high calcium feeds such as alfalfa or certain supplements.
Gosh, I can only imagine the stress for an owner nursing a rescued, starved horse back to health, only to potentially face this hidden danger with refeeding syndrome. Have you seen cases where people with the best intentions accidentally made things worse because they just didn't know about this?
Absolutely. It's a truly heartbreaking situation sometimes, and it really underscores why awareness about refeeding syndrome is so incredibly important. Owners are, understandably, so eager to see their horse gain weight and recover. They might offer a nice, rich grain meal thinking they're doing the best thing, not realizing the profound electrolyte storm it can trigger internally. Education on that slow, careful reintroduction of specific types of feed is just paramount to avoid these severe, sometimes fatal complications.
It really highlights the need for veterinary guidance in those situations.
Hmm.
So what's the overall outlook? If a horse is diagnosed with hypophosphatemia, is the prognosis generally good? Or can it be pretty serious?
The prognosis is highly variable. It really depends heavily on what caused it in the first place and how severe the deficiency actually is when it's caught. For, say, mild cases caused by simple dietary issues that get corrected promptly, the prognosis is generally good, even excellent.
Huh? Yeah.
However, for severe acute hypophosphatemia, especially when it's part of that refeeding syndrome complex, the prognosis can be much more guarded, even poor. Refeeding syndrome itself can be life-threatening because of those severe electrolyte shifts and the potential for multi-organ dysfunction hitting the heart, muscles, causing those hemolytic crises.
Right.
Similarly, if the hypophosphatemia is due to severe end-stage chronic renal failure, well, the underlying kidney disease itself is often progressive and ultimately limits the prognosis. Signs like profound weakness, significant hemolysis, or those neurological signs we talked about, seizures, disorientation, those all indicate a really critical situation. And if a horse doesn't respond well to treatment, that also carries a poor prognosis. So early recognition and prompt, careful intervention are just absolutely critical to prevent the worst outcomes.
Well, this deep dive into equine hypophosphatemia has certainly been eye-opening. Profound insights, really. Who knew that one simple mineral could have such incredibly far-reaching impacts? From, bone strength and muscle function all the way to brain activity and keeping red blood cells stable. Phosphorus really does seem like the quiet powerhouse in the horse's body, doesn't it? Working away behind the scenes until it's missing.
It really is. And what's particularly fascinating, I think, is the sheer complexity of it, especially that unique way the horse kidney handles phosphorus, leading to that paradoxical low level in chronic renal failure. That's quite something. And of course, the critical importance of understanding and managing refeeding syndrome. That just underscores how essential balanced and careful nutrition is, particularly when you're dealing with a compromised animal.
It truly highlights the body's delicate balance.
Mhm.
It does raise a question, though, doesn't it? If the signs of something as critical as hypophosphatemia can be so nonspecific, often until it's quite severe, what does that mean for, say, proactive health management? For routine checkups, this dive into the hidden world of phosphorus, it reminds us that sometimes the most crucial insights come looking really closely at things that might seem small or simple at first glance, but are actually fundamental to life itself.